stop buying masks. Let's take a step back here a second. All you keep hearing about is that masks are not effective in protecting the general public from catching coronavirus, right? You're all hearing that? Yeah. Right. But at the same time, you're hearing, right, that you're going to leave them to the medical professionals because they really need them for protection. How does that work? Do they work or not? Which is it? Well, let's go through this. This is a surgical mask, right? It is not designed to keep germs out. It's designed to keep germs in. Like when I open a patient's chest, that's me in the operating room, you don't want me breathing my germs on their insides. And that's why we recommend people who are sick wear them so they keep everyone else safe. Right? Now, these masks are different. This is the one that might work. They're called N95 Respiratory Masks. You've heard a lot about these. They are sold in hardware stores. We also wear them in the hospital for respiratory outbreaks. They are designed to keep 95% of small particles out of your nose and mouth, including germs. That's why they're called N95. But they only work if they're fitted correctly. Every single year, I go to my hospital and get fitted. So does everybody else. So who better to show us exactly how to do this than Dr. Robert Amler, Dean of the School of Public Health at New York Medical College. He's faced several health crises while he was a chief medical officer at the CDC. Thank you for serving the nation. And also George Contreras is here, and Professor Contreras is going to demonstrate how this is actually done. Again, I go through this every year, but I want you to see what really needs to occur. So let me get in the middle here. Sure. Walk me through this. First of all, there are two sizes here you got.
Correct.
They're multiple, and you have to get the right size.
Absolutely. That's the key point here, is to get the right size, because otherwise there's no seal on your face, which is the whole point of why you're getting this.
Okay, so I put this on. Dr. Amler, walk us through what we're doing here. So I put this on the right way.
The right way. So you cup it like so.
It's got to fit real tight against your face. And it's good that you shaved this morning, because if you have a beard like me, the hair prevents a tight seal. So you can't wear this if you have a beard or facial hair. Also, it cannot be worn by children, only adults.
And this is the hood that's going to go over you. And so what happens, this entire process will take anywhere from 10 to 12 minutes. And I'll explain why. So right before we did this, had this been an actual test, we would fill this up and we would conduct a sensitivity test. What that would do is we would spray a little bit of this through the little hole right here. You can see. Spray it, and then you would be able to taste what is in here.
Right.
Once you taste that, means good. You have good sensitivity, then we can move on. Now, when we actually do the fit testing, we use a solution that's much more concentrated, and then we would do the same thing. Now that you have the mask on, we would put this in here. We would spray at least five times, and then you would have to go through a whole process. First, you would have to breathe deeply for 1 minute, casually, then breathe normally for a minute. Then you would have to move from side to side for a minute, up and down for a minute. Then you would have to read this passage while you're wearing that, read the entire passage. You don't have to do it now, but afterwards, then you would have to actually grimace, frown. The whole point is to do movements that you would actually do while you're doing patient care. And then the last one is to bend over, like you're going to tie your shoes, right? The whole point is to mimic activities you would do as a healthcare provider. Then the whole point is, if you don't taste anything, then you have a good seal.
You're looking to make sure nothing's getting in from the side.
Absolutely, from the entire seal. That's why if you have a full beard or any kind of stubble, actually can inhibit that seal. So that's why it's important. If you don't pass this, then you would need to have another type of mask.
Right, so again, no one's doing this, folks. Right? If you're not doing it, then you don't know if these work, because if there's a big gap between this mask and your face, it's not going to protect you anyway. So why waste money buying them? Because they're expensive. They're pretty, they've been more expensive because there's a shortage, and you're taking them from people who need.
That's right.
Thank you very much.
So, thank you.
So here's what I'm most concerned about. With this shortage of masks, and it's a big one, as Dr. Krupain outlined, think about it. There are nurses, healthcare providers risking their lives, right? But now they won't be able to work because they get sick. Right? And then they can't help someone like you when you really need their care. So if you're stressing out about getting your hands on a mask, let it go. Because there may be something even more effective to keep you